Americans spend billions of dollars each year to feed and care for their pets.
And that's prompted a remarkable new level of veterinary care, piggybacking on technologies that are used to treat humans. 9 on Your Side reporter Tom McKee joins us now with how this is helping your vet. Tom?
Well, Carol, when our golden retriever George developed liver cancer, my wife and I discovered an amazing new world of high-tech pet care. Dogs and cats getting radiation oncology treatments, procedures to correct abnormal heart rhythms, and much, much more. When Robin Lefevre decided to add pets to her life, she adopted a pair of cats, brother and sister, Jack and Lucy.
They were so cute, they were so much fun, and they're just a joy to have.
Things quickly changed when Lucy was 8 months old.
She was just extremely lethargic. When I would go to feed them, she wouldn't come and eat.
Soon, Lucy began vomiting, so Robin took her to the animal hospital on Mount Lookout Square. Dr. Kevin Rebrovich did a thorough examination and had some bad news.
She was going to die. She was on her last legs when she came in.
Things were so critical that Dr. Rebrovich consulted with internal medicine specialist Dr. Jenny Wells of MedVet in Fairfax.
Lucy was initially worked up with x-rays, abdominal ultrasound, lots of infectious disease testing, looking for an underlying cause. We then did the bone marrow aspirate and biopsy.
The conclusion? Lucy had immune-mediated anemia and needed sophisticated care right away.
The treatment piece was at least 2 blood transfusions here and immunosuppressive medications.
That's the sort of highly specialized care MedVet delivers daily.
We're getting more and more like human medicine in terms of the offerings that we provide.
Dr. Amy Snyder is MedVet's medical director.
We work closely with the referring vets to let them provide what they can do, and then we just add on top of that.
The range of treatments is extensive. For example, this dog is getting hydrotherapy, physical therapy in water, taking the pressure off the animal's legs. Technicians prep this dog for a heart procedure called an oblation to correct a rhythm disturbance. MedVet is the only place in North America where it's currently available.
We've had them from as far away as Alaska. We've had them from Oregon, Washington.
This dog from Philadelphia was running freely after the treatment to correct congestive heart failure. Pets with cancer come from all over the country as well for diagnoses using the latest CT scan equipment plus ultrasound technology. Treatments can be done through traditional chemotherapy or through the use of a new radiation oncology facility.
We can pinpoint our dose a lot more accurately. We can protect more normal structures. We can kind of cone down on an area really to maximize the dose to tumor tissue and protect normal structures.
Surgeries occur daily for cancer, knee problems, ACL tears, and hip replacements. Dr. Carl Matitato says he never forgets the importance of his work when he's operating.
I think of the pet, but I also think of who I'm trying to get it back to. The person that's waiting on the other end 2 days from now when that dog goes home.
For Lucy, the treatments worked. She's now healthy and active, except for a newly diagnosed case of feline asthma.
To take such a sick kitty at such a young age and turn her around like this is why we do this job.
She owes her life to Jenny and all the ER docs who helped along the way.
For Robin, getting Lucy healthy again wasn't cheap, but she says it was worth it.
She's like my family. I mean, I love her, so if there's a chance that she could live and that she could recover, I couldn't say no to that. The final decision in these cases is always up to the pet owner. In our case, George was 13 years old, very sick. We made the tough choice of not putting him through surgery or chemotherapy and had him put down, Clyde.
And I can imagine that was very tough, Tom. You mentioned earlier about this not being cheap care. What does this kind of care cost?
Well, prices can range from hundreds to thousands of dollars, depending on the treatment you want from your family vet and from these specialists.
All right, Tom, at least we now know that kind of care is available. Appreciate very much that report. Thanks.
And that's a tough part of the decision, too, is the cost. But they are like members of our family.
Absolutely, they are.
Isn't that the case?
Yeah.
Yes, they are.
Yeah.
Steve?